Good afternoon, everyone. Thank you for coming at short notice. I've just come from an emergency management team meeting and I have some important news to share, and will detail what it means for Western Australia over the Christmas period. I can announce that Western Australia has one new local COVID-19 case. That case is a backpacker, case 1133, who travelled into Western Australia from Queensland earlier this month, a 25-year-old man who was originally from France. He felt sick on Sunday and got tested yesterday. The result came through this morning and it was a strong positive. The advice at this point is that it is unlikely to be the Omicron strain and therefore more likely to be the Delta variant. Investigations have confirmed the backpacker came into Western Australia 11 days ago on Sunday night, December 12. The day before, in fact, I'm advised 1 hour before, we introduced a harder border with Queensland. On Saturday, December 11, we announced that Queensland would be reclassified from very low risk to low risk as of 12:01 a.m. on Monday, December 13. Under our very low risk setting, the backpacker therefore wasn't required to be tested before arriving. Unfortunately, the backpacker is not vaccinated. His girlfriend is also symptomatic and has been tested and moved into hotel quarantine. Further investigations have confirmed he has been living with 4 other people at a house in Girraween. These 4 people have been camping, but they have since been contacted and are now undergoing testing. They will also be directed into hotel quarantine. Health has identified several exposure sites across Perth. These include Aldi The Square Mirrabooka on December 22, Kmart The Square Mirrabooka on December 22, Vinnie's Mirrabooka on December 22, McDonald's Girraween on December 19, the Perth Mess Hall on December 19, Connections Nightclub on December 19, Geisha Nightclub on December 19, Dan Murphy's Joondalup on December 18, the Bloody French Restaurant in Subiaco on December 17, Palace Cinema, Rains Square on December 17, the Galway Hooker Pub in Scarborough on December 16, the Scarborough Sunset Markets on December 16, and the West Australian Museum Boulevardipe on December 16. A comprehensive list can be found on the wa.gov.au website with all the specific exposure dates and times. If you've been to any of the exposure sites or if you are feeling unwell, it is important to get tested. Clinics are in the process of being ramped up. They will stay open tonight until 10 p.m. and keep operating throughout the Christmas period, including Christmas Day and Boxing Day. As always, our dedicated staff will of course do the best they can, but please be aware there will be queues and it's very hot, so be prepared and bring water. Thankfully, the backpacker has been checking in using the Safe WA app. This has enabled us to identify very quickly a comprehensive picture of the man's movements since his arrival in Perth. This has allowed our contact tracers to directly reach out to hundreds of people who have also used Safe WA at the same locations. It is also an important reminder for us to keep checking in using the Safe WA app now more than ever. Obviously, some people have dropped away from checking in, but this proves why we need to ensure everyone does the right thing so we can keep track of any potential outbreaks. Health staff are very busy working to piece together a clearer picture of the level of risk to our community. But as we know, when it comes to COVID, the situation can change very dramatically and very quickly. That is why it is important we take immediate steps to limit any potential spread until we get a better understanding of the level of transmission from case 1133. So from 6 p.m. tonight until at least 6 a.m. on Tuesday, December 28, the following rules will apply across Perth and Peel. Masks will be mandatory in all public indoor settings, including workplaces, shopping centres, hospitality venues and public transport. The mask mandate will not apply to the home, and they will not apply for people doing vigorous indoor exercise. We are recommending masks be worn outside when you cannot physically distance, so we are urging people just to use common sense. High-risk, large public events like music festivals will be cancelled during this period, and all nightclubs will be closed. All dancing banned except for weddings. In addition, the mask rules will also apply to anyone who has been in Perth or Peel since Thursday, December 16, and are now located in a different part of the state. I know this is not the news we wanted to hear 2 days before Christmas, but unfortunately, this is the reality of COVID-19. No matter how hard our border controls, the virus can sneak into Western Australia. We now need to face the potential of community transmission in Perth and Peel. That's why I'm asking everyone to please do the right thing over this period. While our contact tracers and testing staff do their work, we all need to do our bit. Let's follow the rules, wear a mask and get vaccinated if you haven't already. And please get tested if you have any symptoms or if you've been to any of the potential exposure sites. I'm going to hand over to the Minister for Health, who's going to provide you with more information.
Thank you, Premier. I'll just reiterate some of the testing arrangements that are in place over the Christmas period. So as the Premier outlined, our contact tracers are working around the clock to identify the movements of this confirmed case and his closest contacts. We've increased our contact tracers to 70, working on this situation, with the capacity for additional contact tracers to come online if needed. Many hundreds of people who did the right thing and checked in at venues using the Safe WA app have received messages asking them to get tested and isolate until they return a negative test. We're also increasing capacity at testing clinics. Testing clinics will be open until 10 p.m. tonight, tomorrow from 7 a.m. to 8 p.m, so that's Christmas Eve from 7 a.m. to 8 p.m, on Christmas Day from 7 a.m. to 8 p.m, on Boxing Day from 7 a.m. to 10 p.m. Our private clinics will also be keeping these same hours. We are going to be experiencing some warm weather over the next few days, so please go prepared and make sure that you take water and a hat. A list of the testing sites will be available at Healthy WA, and anyone who has been at any of the exposure sites, which can be found on wa.gov.net.au, we urge them to get tested and isolate until they return a negative test. I'll now pass back to the Premier for questions.
Any questions?
In respect of timing, he felt that this backpacker felt sick on the Sunday. He went for a test on the Monday?
No.
So he felt sick on the Sunday and he went for the test on the Sunday and the result came back positive on the Monday.
No, I'll just give you the exact time frame. He felt sick on Sunday. He went Sunday evening. He went and got tested yesterday, and the results came through this morning.
I'm sorry. He was tested on Wednesday.
Yes. So today's Thursday. So I'll say it again. Sunday evening, he felt unwell. He decided to get tested yesterday. The results came through this morning.
Is that a bit disappointing?
Sorry, hold on, James.
Premier, do you know how many people have been contacted by Health having been at these locations?
Oh, I think it's in the hundreds. It's in the hundreds. So as you can see, he's a backpacker who went out and went to nightclubs and bars and restaurants and museums and all that sort of stuff. So it's in the hundreds. And so that's why we're so concerned, because he's been to events where there's been lots of dancing and lots of fun and lots of interaction by lots of people in close proximity. So that's why we're so concerned about it. So some people probably say we're going too far in our reaction to this because it is one case, but the venues he's been to and the length of time he has been potentially infectious means that we have to take these steps.
Are we one step away from being locked down?
No.
Why are you resisting lockdown?
Well, because we have such high levels of vaccination. So we're now at over 91% first dose over 12s. We're at over around 84% double dose over 12s. For the over 16s, obviously it's even higher. I expect this event will mean there's far more vaccination occurs. So we're at very high levels of vaccination. In fact, almost world-leading levels of vaccination. So this gives us a level of protection. That's why I've been saying it, banging on about it every day for months on end. Please go and get vaccinated, because you never know what's around the corner. And here we are, it's arrived. He came in 1 hour before the hard border went up with Queensland. It's arrived. We hope there hasn't been community spread, but there may have been. So we'll hopefully find out the answer to that question in coming days. That's why we're taking the steps we're taking to protect ourselves as best we can if there has been any spread of the virus.
And Christmas Day, you mentioned that masks aren't needed to be worn at a house. Assuming there's no capacity limits in houses, Christmas days can proceed as normal?
That's right. Christmas Day will proceed as normal. So the mask wearing mandate applies in all public indoor settings, workplaces, shopping centres, hospitality venues, public transport. So all indoor settings, hospitals, wherever you might be, except for family homes. Those sorts of family lunches and get-togethers, obviously we're not going to put in place a mask mandate for those.
So Queensland was at low risk when he came in?
No. Queensland was at very low risk. He came in 1 hour before it went to low risk.
And do we know when he arrived in Australia?
Well, I'm advised he came in 1 hour before. No, I don't know the answer to that.
Is it a bit disappointing that he took so long to get tested?
No, well, he's a backpacker. He felt unwell. At the time he left Queensland, there'd only been a handful of cases in the whole state reported when he left Queensland and he came here. So I don't think he would have been thinking he could have been COVID positive, but it turns out he was.
Have you been given advice on how likely this is to lead to further cases?
Well, you don't know with COVID. You don't know. So we don't know. That's why we're encouraging everyone who has been to any of the exposure sites, anyone who shows any symptoms, please go and get tested. The testing clinics are there. We're ramping up the staff. We're expanding the hours. As I said, they're going to be open till 10 p.m. tonight. Depending upon demand, they'll be open till 10 p.m. tomorrow night. They'll be open on Christmas Day and Boxing Day. So we'll have staff there over those 42-degree days testing people so that we can try and find out if there has been any spread of the virus. But if you see the sites that he went to, nightclubs, shopping centres, museums, bars, restaurants, he's been to lots of places. So there's lots of people who have potentially been exposed. And often, and as you've seen interstate and overseas, when people are in proximity dancing, in nightclubs in particular, they can be super spreader events. So that's why we're so concerned, and we're encouraging everyone who's been in any of those venues or feels unwell, please go and get tested.
Is it mandatory?
WA unvaccinated?
Yeah, well, Queensland was very low risk, and the rules for very low risk jurisdictions based upon health advice was you were not required to be vaccinated. Obviously, Queensland went to a low risk setting an hour after he arrived here, and so therefore the vaccination requirement kicked in at that point in time. Bear in mind, a lot of the criticism of us at that point in time was we moved too quickly on Queensland and bringing it up to a higher level of restrictions, or a harder border, if you like. And at the time when he left Queensland, on the day we announced a hard border, there'd been one local case in Queensland. So there was a lot of criticism we moved too quickly, but as you can see, you never predict what happens with COVID.
Getting into Australia unvaccinated, you're going to try to follow that up to work out what's...
I don't know the answer. I think we're more focused on dealing with the problem at hand rather than finger pointing.
Is it mandatory for the contacts to isolate while they wait for their test result? And if so, how long is it going to take for them to get their result? Because they may be isolating for Christmas Day.
The advice is for anyone who's a contact, close contacts have to get tested and isolate for 2 weeks. So I'll start again. Close contacts need to isolate and get tested, and that's a 2-week period. For casual contacts, it's isolated until you get a negative test. So at the moment, the vast majority, overwhelming majority of people are casual contacts, so they'll need to isolate and get tested. But look, if they have to isolate over Christmas Day, that's an unfortunate reality, a sad reality, but that's the reality of COVID.
So how many close contacts do you expect are going to be isolating for the next 2 weeks, irrespective of their test result?
At this point in time, we know of 5 close contacts, but that is the backpacker's girlfriend who's showing symptoms, and his 4 housemates. The number of close contacts may grow as you investigate. The number may grow. But at this point in time, in terms of casual contacts, we think that will be in the hundreds.
Why are we bringing in mask restrictions? Obviously, the Prime Minister yesterday didn't want to see it mandatory, given we're at past 80% vaccination now, we're only 6 weeks away from opening. What was the decision making behind bringing in the mask mandate?
Wants to stop the spread of the virus if it's out there. New South Wales has brought it in. Most places around Australia have it. It's to stop the spread of the virus if it's out there. As I said, if it was one truck driver who visited a service station and slept in his cab, we probably wouldn't be doing this. But this is a backpacker who's been to multiple nightclubs, restaurants, bars, where there's hundreds of people, and he's been infectious in the community for an extended period of time. So therefore, we're taking this action.
There's no rules in the home. Is it still safe to host a large get-together on Christmas Day?
Well, we discussed this at the emergency management team meeting this morning. Obviously, home events are different to nightclubs and shopping centres and the like. One of our concerns was the Boxing Day sales, which are obviously a bit mad, but that's why we put in place mask wearing for those large venues in which large numbers of people gather. So I think that's a pretty fair approach. A lot of people argue we've gone too far, but saying to families, perhaps mum and dad and children and in-laws sitting around the table, they've got to wear masks on Christmas Day, I think was a bit too far.
Do you know when he arrived, when the backpacker actually arrived in Australia?
No, I don't.
Because it's just there's a lot of questions about how he would be able to get. I know it's not it may not be your jurisdiction, but there's a lot of people questioning how he's actually allowed to get into the country.
I don't know
without
the
being
answer.
vaccinated.
I don't know the answer to that. I don't think we do.
Are you chasing it?
I'll let you finish.
No. Well, are you chasing an answer to why he could get into the country? Obviously, it's a federal jurisdiction. You can ask them.
He's being interviewed as we speak by our contact tracers. Our main priority is to find out where he's been, because obviously when you've been in the community for 12 days, particular infectious from the 16th of December, you want to find out every single place you went to. And I don't know about you, but if you ask me where I've been over the last 12 days, every single spot I went to, it's hard to remember. So the main thing is that we track his movements entirely over the course of that period of time, so we can work out every single place that needs to be declared an exposure site. In terms of his arrival in Australia and the like, you know, I suppose we can ask those questions, but our main priority at this point in time is trying to keep people safe.
Why don't we consider the nightclubs and the contacts there closer contacts, given that we know that the virus travels by aerosol and they're quite humid environments?
Look, sometimes if they pick up cases, I understand then people will be converted from casual to close. We just need to go through the process. The contact tracing teams have these processes they operate with.
What would you say to people travelling north or south for Christmas?
Well, there's rules about that. I'm not going to say to people you can't travel north or south. I'm just saying if you leave Perth now, the requirement is, at least for the next 4.5 days, you're required to wear a mask. Now, that may extend. We'll just see what we pick up through our testing clinics over the course of the next 4 days.
Do we know which variant of the virus it is?
We suspect it's the Delta variant. The initial testing indicates that, but they have to do the whole genome sequencing, I think it's called, to work out whether it's the Omicron variant. But at this point in time, we think it's the Delta variant. If it's the Delta variant, that's less infectious than the Omicron variant. So whilst that's, you know, none of this is good news, at least it's better than the more infectious variant.
Why do you suspect it's Delta?
Because the initial testing indicates that, and also because when he left Queensland, Delta was the dominant strain.
You said, I think, that the 4 housemates were camping this week, or maybe right now. Where are they camping?
We don't know. We know it's somewhere in Mandurah or somewhere around Mandurah, but they've gone to get tested and they'll be placed into a form of hotel quarantine pending results.
Some people in the testing queue said they found out they'd been to an exposure site through social media and they hadn't received a text yet. Is that a failing of the system?
No. The system is ramped up. We obviously don't have hundreds of people sitting there with no cases for 6 months. We ramp up the system when we get cases. So advice has been provided. I learned about this 4 hours ago. We're providing full advice on everything we know as soon as we possibly can.
What time did Health first learn about this?
This morning, I learnt around 10 o'clock or so.
There's going to be some families that are pretty, obviously, under the requirements when he came in, he wasn't required to be vaccinated, but there's going to be families who are pretty upset that they would give their right arm to get into WA for Christmas, and they're going to be hearing now that an unvaccinated French backpacker was able to get into the country and into WA. I mean, what would you say to those people?
I can't control who comes into Australia and the way they do. Some backpackers have remained in Australia for the entirety of the COVID period, so they were here before the border before COVID even came about. So some of them have been here for 2 years or more. So he may be someone like that. I don't know the answer to that question. But he came out of Queensland. You've got to remember, and I'll explain our system to you, we had different rules for different states based upon the risk and the spread of the virus in those states. He came out of Queensland. On the day we announced the harder border with Queensland, there was one case in Queensland, but we were very precautionary, and so we took the steps we thought we needed to take to protect ourselves. Now, there was one case that day recorded and reported. There were 6 cases the day before, but overall, for a state double the population of Western Australia, it was a very small number. So he travelled in, as many people did out of Queensland, under the very low risk setting that Queensland was on at that point in time.
We've heard stories from people who were at these venues but didn't check in, and so heard nothing official from health. What's the advice for those people, and is anything more being done to track down people who didn't check in?
Well, my advice to all of them is go and get tested as soon as you can and isolate pending a result. And if you feel unwell, go and get tested again. So to all those people, if they didn't check in, we're basically providing as much advice as we possibly can that they should go and get themselves tested as soon as possible.
What about Christmas Eve church service?
Well, they will be, so the church services over Christmas, both on Christmas Eve and Christmas Day, will be subject to the mask wearing requirement. So there will be able to be these events, but the mask wearing will be mandatory for all of those events.
Crown was always one that was, seemed to be shut down at the drop of a hat. Are they going to be opening during this period, or are you shutting them down?
There's mask wearing requirement for Crown.
Given the, saying that mask wearing is common sense, when it comes to Christmas Day, where there will be a lot of people across Perth, catching up with people that they haven't seen in a while, a lot of cross mingling, why have you decided to allow non-mask wearing?
Well, people having lunch, and I think I've answered this, but people having lunch in their house with their in-laws or their family, we just expect people to use common sense. There's only so much you can actually mandate. We're not going to have police going around knocking on everyone's door and saying, are you wearing a mask at your Christmas lunch? I think that would be unworkable and impossible. So, but in shopping centres, in venues, in pubs, we're requiring people to wear masks. When you're in the workplace, wear a mask. We're actually closing down nightclubs. We're banning dancing at pubs and other venues. So we're doing everything we can to have a reasonable response to the situation we face.
I think you said that you arrived December 11?
No, December 12, I think it was. Yeah, he got here on Sunday night, December 12.
The first exposure site listed is December 16. So we just don't know what he was doing the first 4 days?
We don't think he was infectious over those days. The advice I have is he wasn't infectious over those days.
Is there a specific cap set on large public events?
Well, we're closing down all the music events. So we're doing more than a cap. We're closing them. So there's a whole bunch of events, and I know they're great fun, and I know a lot of young people love them. And at the ice cream factory and various places, we're just saying over the next 4 days they won't be happening.
So what time are the restrictions in place until on Tuesday?
So it's from 6 o'clock tonight, the mask wearing mandate, the closure of nightclubs, the shutting down of the music festivals and the like until 6 a.m. on Tuesday morning.
And obviously help will monitor what will happen over the next few days, but I mean this could potentially stretch out to the New Year's.
Well, we don't know yet. We'll see what we pick up. We'll see what the health advice is. We'll see if the testing brings any more cases to light. If the 4 campers are positive and they've been all over the place, we'll have to investigate that. Contact tracing teams will be working full bore on all these things now. As the Minister said, there's a great many contact tracers now working on this. That's the role, that's the job. So we just want to track down any cases that might be out there and make sure they're dealt with appropriately.
A lot of Perth residents will be planning to travel across the state over the next week or two. If community cases are detected in the next couple of days, what are the chances that you're going to ban travel out of Perth?
Oh, we haven't considered that yet, Peter. That's a good question, but we haven't considered that. We're just hopeful that that won't occur. But at this point in time, anyone who's left Perth since the 16th of December will be required to wear a mask wherever they are around regional WA.
Text messages were going out this morning. Why was the rumour mill allowed to run hot for more than 4 hours without any official confirmation of what was happening?
Yeah, well, okay. So we learned about this morning. I received a text, the Minister received a text, we had some phone conversations about it. I then convened the meeting of the emergency management team for 12:30. At that point in time, just so you know, early on we couldn't find the backpacker, couldn't find him. We didn't know where he was. He got his test, but then he obviously gone off and we had to track him down. And we couldn't find the 4 campers, the 4 people he was living with who were out camping. We couldn't find them. So we had to get information together so that we didn't just call a press conference and announce that we know there's something happening, but we don't know what it is. So obviously we sent out messages to anyone we could trace through the QR codes and the like, because we had that and that was very clear. But we didn't have any other information. For instance, where he had been. We didn't have his exposure sites because we hadn't been able to interview him. So we convened the emergency management team for 12:30 today. As soon as that concluded, I prepared some speaking notes and I came and addressed you.
These restrictions are similar to what we can expect when borders open on February 5 at the moment. Is this what the public can expect when borders open? Restrictions and mask mandates being implemented like this?
Well, as I'm saying, I've said to you repeatedly over the course of the last couple of weeks, I hope we make it to February 5 without community spread of the virus. We'll be lucky to make it that far. This may be the event that provides us with community spread of the virus, very sadly and very unfortunately. And that's why I'm saying to everyone, please go and get vaccinated as soon as you can. If you're eligible for a 3rd dose, go and get vaccinated. From January 10, you'll be able, your 5 to 11-year-olds will be able to be vaccinated. But after February 5, if we do make it that far without community spread of the virus, well, obviously, mask wearing and those sorts of measures will be very commonplace, and I expect they'll be in place for a fair period of time.
So
Would
that
community
date,
spread
that
be
date, the
classed
6
as a
a.m.
catastrophe?
I'm sorry, there's 2 questions at once.
That end date then that you put there, 6 a.m. Tuesday the 28th, could very well just slide. I mean, I'm assuming you just put an end date on there, putting an end date.
Well, we discussed the date so we could actually see if any cases come forward. It could have been 4 days, it could have been 5 days. You just want to find out if there's any spread. It may go for longer. We can't tell at this point in time.
Would community spread be a reason that the date's pushed back?
I'm not understanding your question because obviously if we have community spread of the virus, obviously the 5 February border opening in many ways becomes redundant.
That positive man, what's his condition like? Is he symptomatic?
Yes.
And where was he when he was located this morning?
Oh, he was at a house in the city, at some sort of Airbnb or something, wasn't it? Yeah, some sort of accommodation in the city. So they had to track him down. They had to use his phone pings to find him.
How unwell is he?
Well, the reason he went and got tested is because he was unwell. And now the degree of unwellness, I don't know. But that was the reason he went and got tested, which is fortunate. And that's the reason we know about it now. So he got tested yesterday. We got the result this morning. So the result came through very quickly.
Why does community spread make the date redundant? There are still hundreds of people who would like to know if they can reunite on February 5.
Well, I'll explain. As I've said repeatedly at these press conferences, I hope we make it to February 5 with no community spread of the virus. But obviously if we have community spread of the virus, well then we have to reconsider everything and how we reopen, when we reopen, all those sorts of things. If we get community spread, you know, the borders in some ways will become redundant, and it will be more about whether or not even other states are even doing PCR testing for people who are going to travel. So all of those things will need to be considered. The aim was to get to February 5 with over 90% double dose vaccination of over 12s before such time as we open the borders. But as I said, it's been it's not easy to make it that far because something could happen. And here we have basically a very, very unlikely event has occurred that someone came into Western Australia from Queensland who was COVID positive when Queensland had literally a handful of cases when he left that state.
Do you have any updated data that Safe WA check-ins for November and December?
Not to hand, I'm sorry.
You said that you had to use his phone pings to find him. Was he not answering his phone?
Yeah, he was asleep. I looked at Jeff.
So police knocked on
Jeff,
the door and woke
yeah,
him
he's
up.
20. He's 25 years of age. He's a backpacker. He goes out a lot. He's asleep. So police had to check his phone and go and knock on the door and wake him up and tell him the bad news.
Just a couple for the Commissioner, if you can.
Sure. Nothing more for me. Thank you.
Are you going to be filling your kids' stockings with masks instead of?
I'll leave that one. Over to you, Commissioner.
Commissioner, a lot of people in the testing lines understandably backpackers, and obviously it makes it a little bit tricky in terms of when it comes to isolation. A few are saying they're not really sure where they're going to be sleeping tonight because they've been kicked out or something like that. So what are the requirements, and what are the police doing for those that might be struggling to work out where they're isolating at the moment?
So as the Minister's already outlined, we want people to be patient. Look, people understandably get anxious and frustrated, but this is an important opportunity for people, one, to get tested, two, to be common sense. As we've said, it's hot, take a hat, take some water, be prepared to wait. A lot of these people, of course, are in a moment of, festival mood, recreation. Let's think about those people that are actually working, the health workers, the testers, the vaccinators, the police, all those frontline people, the nurses, the contact tracers. They're not sitting around having Christmas pudding. So we want people to exercise common sense. Yes, there will be queues, and I've got little doubt that I or others will be asked questions and said, why is there a queue? Well, there'll be a queue, I can guarantee it. So we want people to exercise common sense. There's plenty of testing available. Check on the health website, both at private clinics and obviously at the state-run clinics as well. I'll take the opportunity just to add something else. We have 100,000 people who have now had a third dose, but I know that from our stats this morning, there's 165,000 others who have had 5 months elapse who haven't. So there's an opportunity to get vaccinated. You can go along and get vaccinated at about 100 different sites at the moment. We'll even be running some down at Wellington Square in our bus as people are having a Christmas lunch. So we're doing as much as we possibly can.
Sorry, just in terms of the isolation specifically though, when I'm looking at backpackers, and a lot of them are staying in hostels, and sometimes there's shared accommodation. There might be people that have been to those places and haven't. So are police confident that the requirements at these hostels for isolation are sufficient enough in those cases, and will there be any changes if they're not?
Well, as the Premier's already responded, Health are doing as much as they can. Police are assisting in terms of, one, identifying people. I don't expect everyone has probably used the QR code. Now, fortunately, some have been used, but people, again, have got to exercise common sense. People message each other. Go in and get tested. If you've been to any of the venues that have been listed, and of course, if you're feeling symptomatic, it doesn't really matter where you've been. You don't know who you've been in contact with. The virus doesn't respect any person, any venue, any road. It'll go wherever it wants. So we just have to ask people to, one, check on the websites where those venues are and if you've been there. Two, if you're in contact with others that you know that have been to any of these venues, then use your common sense. Go and get tested. Clearly, get vaccinated if you haven't been vaccinated.
The mess hall is one of the exposure sites. Next to that is the barracks, which is the hostel. And a lot of those people have gone off to get testing because they're actually at the mess hall. I think the question was around, are you talking to the people at the barracks about how these people would be accommodated and quarantined for the period that they need to quarantine?
So that's a fundamental that contact tracers do, and so we've got Department of Communities that provide alternative accommodation. So those sorts of agencies all working together, but clearly if people are staying at a location where they're in contact with others or they've been to particular venues, again, use your common sense and isolate, get yourself tested. Just because someone has been to a particular or staying in an accommodation may not mean that they're infectious, but we've got to assume the worst. So that's why, one, get tested, two, get vaccinated, isolate.
What kind of effort went into finding the 4 campers?
Oh, look, it's emerging as we speak. So, as the Premier said, this has only occurred in the last few hours. So, one, they've been contacted, they've been tested, and we haven't got the results back yet.
Private.
Was it through phone pings or?
I don't have that particular information. We did on the initial fellow was located, but at this point in time, look, everyone's cooperating. I don't have any information to say that people are being uncooperative, and at this stage we'll work through it as quickly as we can.
Private events can go ahead restriction free. Is there a size of private party that would be inappropriate given the current setting?
So the directions that come into effect at 6 o'clock tonight apply in all public venues. In a private home, there's no restriction in terms of the numbers of people in a home, for instance. But again, common sense has got to prevail here. So we're just asking people to use common sense in a private setting. But if you're going shopping, if you're going to do last minute to buy drinks, etc., you will have to wear a mask and you know, while it's at 6 o'clock, that's an arbitrary rule that we're putting in place to give people and businesses as much chance. You've seen that a number of us are wearing masks here, then people can exercise their own choice. If they want to wear a mask now, then we'd strongly encourage it.
So you could still throw a 100-person party this evening?
If you've got a big enough house, you could.
And what are the penalties for the businesses, nightclubs that are caught breaking those rules?
Okay, so one, nightclubs won't be open. If they want to open, it's a $50,000 fine, so I'm confident they won't. They've been responsible and they know about that. We've had actually good cooperation through the AHA and the licensed premises. I know that, you know, people advocate and they quite openly say that it's impact on business, it's a busy time of year. We know that. I think the compromise that's been here is that most of the venues will be open. We're asking people to wear masks and we appreciate that, look, this is a very, very busy time of year. We're doing as much as we can. We're not doing this because we want to penalise businesses or anything like that. We're doing it to limit the spread of this disease. 5,715 in New South Wales today. People just got to exercise a lot of common sense here. We've got one case, we expect probably some more, and we're doing it in a measured way.
Given the specifics around this case, that he was unvaccinated, was there any consideration about introducing vaccination as a requirement to get into pubs, cafes, the venues that are going to be staying open now?
We take the Chief Health Officer's advice and we've done that.
The mask mandate will extend to people from Perth who are leaving the region. What about if they're leaving the region to go visit family? Will they have to wear their masks whilst visiting family?
Are you asking if people coming into the Perth Peel region?
No. So if someone from Perth is going down south to visit family, what are the rules on the masks there? I know because houses aren't.
I'll just quickly step it out. If you've been in the Perth Peel region since the 16th of December, that's when, on health advice, we believe the individual became infectious and would be at risk of passing it on to others. Any person that's been in the Perth Peel region from the 16th onwards, if you depart today to go to Albany, for instance, or fly to Broome, you'll be required to wear a mask if you're inside a venue, not in a private house. So that's a requirement that will apply to anyone that departs the metro area and goes somewhere outside the Perth Peel region for Christmas. Okay.
Dr. Armstrong, are you taking the question? Sure. I wonder if you might step us through what the ramifications are of it being more likely Delta than Omicron?
Hi everybody. So there are a number of tests that we can do to determine whether it's Omicron or Delta or any other strain for that matter. It will take another day or so before we get definitive information about that, and that's the whole genome sequencing, which looks at a lot of the genome of the virus, and it can tell which ones are which. The early indication, there are other tests that can be done in the laboratory that can give an early indication that it's probably one or the other, but it can't be definitive. So those early tests indicate at the moment that it's not Omicron, but we'll need to await the whole genome sequencing results before we can be sure about that.
Could that mean that it's less likely to spread but could be more deadly?
Well, we know that Omicron is spreading at a very, very fast rate, much faster than Delta. We thought Delta was fast until Omicron came along. So there will be certainly a different risk setting if it's Omicron versus Delta. We know that, well, we don't know everything about Omicron yet, but it's developing that it seems to be less severe than Delta, but much more transmissible. So on balance, in fact, even though Delta was considered to be a terrible thing when it came on, which it was, it's less likely to cause a pressure on the health systems and on society than Omicron.
The Queensland couple from earlier this week, they were Delta, weren't they? Or do you not know?
Look, I'm not sure about that. I'd have to check on that.
Was genomic testing or whatever it is done on them?
Yes, that would have been done on them, and I just don't have that information to hand.
Can you step through the decision to allow residential, well, no mask in residential settings, but in public settings?
Well, I think the Premier and the Commissioner addressed that. So it's about a balance of trying to prevent a risk of spread of the virus, and the vaccination rate in the community is much higher now than it was in the past when we've had perhaps more stringent measures. So it's just about where you put that line, and the other reasons that the Commissioner and the Premier have said, the reasons for that are valid.
Health Minister? Sorry. How long is it going to take for those who get tested to get their result?
We're not expecting any delays in getting the results because we're maintaining, in fact we've increased our testing capacity. So the same amount of time as it has previously, so I think for some people it's a matter of hours, for others it might be a couple of days. But generally we're not expecting any for that to blow out at all.
Are hospitals and ICU departments been prepared should this escalate any further?
Well, over the last 2 years, an enormous amount of work has gone into preparing our hospitals for a potential outbreak. We have made a significant investment. We are also putting online a number of beds, and more than 200 of those will be online by the end of this year. We already have ICU capacity with the ability to surge up to 300 ICU beds and ventilators and have those staffed. So the hospital system is well prepared, but if we put in place these sensible public health measures and with the higher rates of vaccination, we think that will serve us well.
Will the COVID positive cases go into hotel quarantine or home quarantine?
Well, that's all determined by the health advice and determined on circumstances. So if someone has the right circumstances to isolate at home, then they may be given permission to do that, but that's done on a case-by-case basis, depending on their circumstances.
So what's happened with these people then?
Sorry, which people?
So, well, the backpacker and his girlfriend and the 4 campers.
The backpacker and his partner are in hotel quarantine, and at the moment the department is attempting to arrange hotel quarantine for the 4 campers.
Are you encouraging Western Perth residents specifically to wear masks, say in the office, which is a private setting, or wear masks while outdoors?
Well, I would consider the office probably a public setting, actually. Yes, you should wear masks indoors. So it's really anywhere but the home.
So if you're outside, though, it's only encouraged?
It is encouraged, yes.
Okay, so that won't be enforced. So just to be clear, is masks in offices mandatory or voluntary?
Masks in offices are mandatory.
And vigorous exercise, it was mentioned before, but they're not required.
The same rules that have been put in place previously around vigorous exercise indoors will apply. So they're not mandatory if you're doing vigorous exercise, but they are if you're not. So if you're on a treadmill and running, you don't need to wear one, but if you have a personal trainer next to you, they should wear one.
In February, we saw testing clinics and be overwhelmed by numbers of people lining up for hours. It was, I don't remember exactly, but similar high temperatures around that time. Can you just give some advice for people who might be looking to get a test tomorrow, how they can beat the heat?
Look, as the Commissioner has said, there will be queues. There will be many people seeking to have tests and do that as early as possible to avoid being in isolation over Christmas. I'd say plan where you're going, make sure that you go well prepared, take water, take a hat if you're going to have to queue outside, and take sunscreen. But make sure that you're well prepared, and there will be waits.
How hard are we going to go at this and try and stamp it out, given that vaccination rates are so high and the borders are going to be reopening this week?
Well, we're assessing the situation on an hourly basis as we get more information. What we've put in place today is a proportionate response based on the information that we have.
Thanks.
Thank you very much.